If antidepressants could instantly lift the weight of depression, life would be so much easier. However, depression isn't as simple as just feeling sad or down. It is a complex medical condition which affects how a person thinks, feels, acts, and functions in their daily life. SSRIs, also known as selective serotonin reuptake inhibitors, are the most commonly prescribed drugs used in the treatment of depression. However, contrary to popular belief, these drugs do not work instantaneously. In this video, we will be breaking down how SSRIs actually work, how they help over time, and why their understanding matters more than ever.
7:59 a.m.
So AINUL, this is your medication.
Thank you, doctor.
Later that same evening.
Eventually, I will get better after I take this medicine.
8:01 p.m.
I'm so tired. Why I don't feel any better? Maybe the medication needs one more day to take action.
2 days later.
It has been 2 days. I still feel sad. Isn't it supposed to work like a painkiller? Why is nothing happening to me?
Hey, are you okay? Hey, why you look so depressed? What is that? Let me see. Oh, SSRI. I understand how frustrating it is, but SSRI doesn't work instantly like painkiller.
So how long it will take for me to feel better?
Usually it takes 4 to 6 weeks for you to feel better.
So why does SSRI takes 4 to 6 weeks to work? Is the delay a flaw?
So firstly, SSRI increase serotonin levels in synaptic cleft within hours by blocking its reuptake. However, this immediate increase does not translate to immediate symptom relief. The effect comes from longer-term brain changes.
The brain must adapt to the new serotonin levels. Receptors may be firstly overly sensitive or desensitized, but over the weeks, it will adjust the receptor activity and density, thus improving the signaling pathways. This process is called neuroadaptation and it takes time.
Next, SSRI gradually increase BDNF, brain-derived neurotrophic factor. It promotes neuroplasticity, the brain's ability to form new connections and repair circuits in mood regulation. So the changes will take several weeks to work.
Finally, SSRIs also trigger changes in gene expression, secondary messengers, and intracellular pathways. These changes help to restore balance in mood-regulated neural circuits, but also again, this takes time.
In a world where mental health awareness is rising, SSRI has taken center stage. But how much do we really understand about SSRI? I would say that there are still people misunderstanding the use of SSRI. The most common misunderstanding is many patients quit SSRI due to unrealistic expectations. They will have the concept that if I don't feel better quickly, that means SSRI isn't working and I should stop taking it. But what actually happened is, SSRI will alter the serotonin uptake in a few hours, but the mood improvement usually takes 2 to 6 weeks. The therapeutic effect comes from the longer brain adaptations, such as changes in the receptor sensitivity. Moreover, the side effects such as anxiety and sleeping disturbance usually will come first before any benefits. Therefore, if patients quit SSRI too quickly, they will miss the therapeutic benefit and may have greater risk to have relapse symptoms. On the other hand, there's another situation that patients still continue taking SSRI, but they will have the misunderstanding that SSRI will cure their depression permanently. But what actually happened is, SSRI just manage our symptoms but do not treat underlying causes such as trauma and also chronic stress. Therefore, bear in mind, depression is a condition where influenced by biological, psychological, and social factors. SSRI is just a puzzle but not the whole picture and not a guaranteed cure for depression.
Quality education empowers both patient and healthcare providers by breaking down the signs that build trust and understanding in the treatment of depression.
When patients learn that SSRIs do not work instantly, but slowly increase serotonin level and trigger changes in the brain over time, they are more prepared for what to expect.
That 4 to 6 week wait is not a sign that the medication are not working. It is a normal part of the therapeutic process. Knowing this can ease frustration and encourage them to stick with medication. So, it is all about turning confusion into confidence, and that start with the right information.
In conclusion, SSRIs are not a quick fix or a cure for depression. Instead, they help to manage symptoms of depression over time. As a result, it is extremely important that patients understand what to expect, such as a delay in benefits and possible early side effects. As such, whether you're a patient, provider, or supporter, remember this: compassion, patience, and progress, healing one step at a time. By keeping the conversation going, we can take the first step towards healing.